Hello, Everione.
My name is Dr. Edward Langley, and I'm 83 years old. As a cardiologist, I've spent my life focused on the health of the heart and blood vessels. For 43 years now, I've had the privilege of working in my clinic, getting to know countless patients along the way. When I started out as a young doctor, full of passion, I believed I could fix every illness. But as the years went on, I learned that something is even more important than treating a disease, and that is preventing it in the first place. This is particularly true when caring for my older patients, those in their 60s, 70s, and 80s. I've come to see that every little ache or pain is a message your body is sending you. If you choose to ignore these signals, they can eventually grow into much larger health concerns. Lately, I've felt a strong desire to share what I've learned about healthy living with as many people as I can, not just with the patients I see in the hospital. That's the reason I've started making these videos, based on my own life experiences and the medical knowledge I've gathered over 4 decades. My goal is to show everyone, especially those of us in our later years, some simple ways to stay healthy right from the comfort of your own home. Today, we're going to discuss a very common issue that many of us face, particularly at night: leg cramps. I'm talking about that sudden sharp pain you feel when your calf muscle just locks up. If you've never experienced it, it's hard to imagine just how intense that feeling can be. I started getting them myself when I was in my 70s, and it was a truly miserable experience. But now, I know a simple 3-second pressure point technique that can bring almost instant relief. Since I learned this little trick, I almost never wake up with leg cramps anymore. By the time we finish this video, you will know this simple and effective method too. At first, I just assumed that getting leg cramps was a normal part of growing older. Then, around the time I turned 75, my calf muscle suddenly seized up one winter night and became as hard as a rock. The pain was just excruciating. It began happening maybe once or twice a week, but soon it became more frequent, especially when the weather turned cold. Before long, I was getting cramps almost every single night. And it wasn't just my calves. My toes and even my thighs would cramp up on some nights. The worst part of it all was that I couldn't get a proper night's sleep. I was so afraid of the cramps that I'd try to sleep with my leg bent, or I'd even end up sleeping sitting up in a chair for much of the night. My wife, Mary, was very worried and kept telling me I should go to the hospital. But I'm a doctor myself. What was it that I didn't already know? I just tried to be stubborn and push through it. Then one night, I had a cramp that was worse than any I'd had before. My calf muscle felt like it was completely twisted, my toes went numb, and I broke out in a cold sweat. That was the moment I first thought that this might be something more than just old age. The very next day, I went and had my blood tested right away. It turned out that my magnesium and potassium levels were lower than they should be. I also had an ultrasound on my legs, which showed that the blood flow was slower than it used to be. That's when it finally clicked for me that these leg cramps weren't just simple muscle spasms. They were a signal from my body that my entire system was out of balance. Are you losing precious sleep because of leg cramps that strike in the middle of the night? If you are, then I believe the story I'm about to share will be a great help to you. I was able to find complete relief from my own leg cramps, all thanks to a very fortunate encounter. One of my patients, a wonderful 88-year-old woman named Eleanor Vance, came to see me for an appointment. Mrs. Vance had been dealing with arthritis for a long time. During one of her visits, she saw me limping and asked, "Doctor, do you get leg cramps at night?" I decided to be honest with her and said yes, telling her just how awful they were. Mrs. Vance told me that she used to have the very same problem, but she had discovered a spot on her calf that brought relief. She explained that you just have to press it for about 3 seconds. At first, I'll admit, I was a bit skeptical. Was there any real science behind this? But that very night, when another cramp woke me up, I decided to try Mrs. Vance's method. I felt for that spot on the back of my calf, in the little hollow between the muscles, and I pressed down firmly with my thumb. It was amazing. In less than 3 seconds, the intense pain of the cramp just melted away. I thought it might have been a fluke, but I tried it every single time I felt a cramp coming on, and it worked without fail. My curiosity got the better of me, so I started looking into the medical research about that particular point. Modern medicine has shown that stimulating this area can improve blood circulation and help relieve muscle tension. Through this experience, I learned that we shouldn't dismiss traditional wisdom. Any method that helps promote good health has value. Now, I make it a point to share this simple technique with all of my patients who need it. Now that you're watching this video, I truly hope you'll learn these effective methods, which I can tell you have been tested and proven by me personally. If you find this video helpful, please consider subscribing and giving it a like. This will help get this useful information out to more people, especially our fellow seniors. The first thing we need to understand is what really causes leg cramps. So many people believe it's just an unavoidable consequence of getting older. In reality, there are several complex factors that contribute to them. The single biggest reason is an imbalance of your electrolytes. For our muscles to contract and relax the way they're supposed to, electrolytes like sodium, potassium, calcium, and magnesium need to be in the correct balance. As we get older, however, our kidney function can decline, and changes in our diet and the medications we take can easily throw this delicate balance off. A second cause is poor blood circulation. After we pass the age of 70, the elasticity in our blood vessels starts to decrease, and blood flow slows down. This is especially true in the legs, which are the farthest point from the heart. When your circulation isn't as good as it should be, your muscles don't get enough oxygen and nutrients. In that state, even a small amount of strain can easily trigger a muscle cramp. The third factor is dehydration. Older adults often don't feel thirsty as strongly as they used to, so their water intake naturally goes down. When your body doesn't have enough water, your blood actually becomes thicker, and your muscles can become stiffer. One of my patients, a 79-year-old gentleman named Robert Miller, used to wake up every single night around 2 in the morning with a cramp in his calf. It was so predictable that I joked with him that he must have a clock inside his leg. After asking him a few more questions, I found out that Mr. Miller was taking medication for high blood pressure, including a diuretic. Diuretics can cause you to lose a lot of potassium, and he also admitted that he didn't drink much water throughout the day. His blood tests confirmed that his potassium and magnesium levels were too low, and other signs pointed to dehydration. So, along with adjusting his medication, I made sure he increased the amount of water he was drinking. I suggested he eat more foods that are rich in potassium, like bananas, potatoes, and spinach. He needed to aim for about 1.5 liters of water a day, sipped in small amounts over time. I also recommended that he do some light stretching exercises for a couple of hours before he went to bed. When Mr. Miller came back to see me 3 weeks later, he looked like a new man. He said, "Doctor, I haven't had a single cramp in a week. I've been sleeping so well, I can't even remember the last time I slept this soundly." I was so happy to see the improvement he was able to make. Leg cramps might seem like a small problem, but they really are a sign that tells us how important overall balance is for our bodies. Don't just suffer through it, try to find and treat the root cause. You should be especially mindful if your leg cramps are happening repeatedly, meaning more than 3 times a week, as this might not be just a temporary issue. In that situation, I would strongly recommend that you have a blood test to check your electrolyte levels. In my experience, a magnesium deficiency is one of the most common culprits. You should also take a look at the medications you're currently taking. Diuretics for high blood pressure often cause you to excrete potassium, which can lead to leg cramps. Some blood sugar and cholesterol medications can have a similar effect. If you're taking any of these, it's a good idea to speak with your doctor about possibly taking an electrolyte supplement along with them. Do you find that you don't drink enough water, or perhaps you eat a lot of salty foods? These small habits can build up over time and lead to leg cramps. The second thing I want to share with you is the 3-second pressure point method that I personally tried and found to be so effective. This method is truly simple. The point we're looking for is on the back of your calf. To be precise, it's at the spot where your 2 main calf muscles meet. If you lift the ball of your foot, you'll see a small indentation form on the back of your leg. That's the spot. From a medical standpoint, several important nerves and blood vessels pass through this area. The method itself is very straightforward. First, you need to find the correct position. Sit down comfortably in a chair and cross one leg over your opposite knee. Now, lift your toes up, as if you were trying to stand on your tiptoes. You should see that little hollow form on the back of your calf. Find that spot with your thumb and begin to apply slow, steady pressure. It might feel a little tender at first, so don't press too hard right away. As you slowly breathe out, press firmly for 3 seconds, and then slowly release the pressure. The breathing here is important. Breathe out as you press, and breathe in as you release. Doing this will help your muscles relax more effectively. Repeat this process 3 times for each leg, alternating between them. One of my patients, a 74-year-old woman named Helen Carter, was losing almost 2 hours of sleep every night because of her leg cramps. She was waking up so often that she felt tired all day, and it was making her daily life very difficult. The first time I told her about this pressure point method, she was a little doubtful. Could something so simple really work? But she promised me she would give it a try that night. A week later, Mrs. Carter came back to my office with a completely different look on her face. "Doctor," she said, "it's truly amazing. When I feel a cramp about to start, I just press that spot, and it goes away immediately. Now I can finally sleep without being afraid of the cramps. Thank you so much." What was even more surprising was that 3 weeks after that, Mrs. Carter told me, "I haven't had a single cramp at all lately. I press that spot every night before I go to bed, and it seems to be preventing them from even starting." And in fact, regularly stimulating this point on your calf can improve blood circulation to the area and also helps prevent muscle spasms. That's why I recommend to my patients that they try it not only when they're having a cramp, but also once or twice during the day as a preventative measure. A recent study actually showed that a group of people who consistently used this pressure point technique for 3 weeks had a 15% increase in blood flow to their legs compared to a group that did not. This means that it doesn't just relieve the immediate pain, but it can also fundamentally improve your circulation.
Here is another important tip for you.
When you're applying the pressure, pay attention to the direction. It's even more effective if you apply the pressure while pushing slightly upwards, in the direction of your heart. This helps with the return of blood flow through your veins and can make the technique even more powerful. There are a few things to be careful about. First, make sure your fingernails are trimmed so you don't accidentally scratch your skin. If you press too hard, you can actually make the muscle more tense, so it's important to find just the right amount of pressure. Pregnant women should always speak with a doctor before trying this method. And people who have varicose veins or a history of blood clots in their legs should also be cautious. Are you trying to find that point as you're watching this video? It's not as hard to locate as you might think. Just take your time to find the exact spot at first. The third thing I want to talk about is daily management to keep leg cramps from happening. No matter how effective an emergency treatment is, it's always better to prevent the problem in the first place. First and foremost, your water intake is incredibly important. Try to drink about 1.5 to 2 liters of water every day. But don't try to drink it all at once, sip it frequently in small amounts. It's especially helpful to slowly drink a cup of warm water about 2 hours before you go to bed. Managing your diet is also key. Make a habit of eating foods that are high in potassium, like bananas, potatoes, spinach, and avocados. Nuts, tofu, and brown rice, which are all rich in magnesium, are also excellent choices. On the other hand, salty foods and processed foods can cause an electrolyte imbalance because of their high sodium content, so it's best to cut back on those. You should also pay attention to your sleeping environment. A quilt or comforter that's too heavy can put pressure on your legs and interfere with your circulation. Also, if you keep your toes pointed down for a long period of time, your calf muscles will stay in a tightened position, which makes you more likely to get a cramp. What I recommend is placing a low pillow or a cushion underneath your feet to elevate your legs just slightly. This will help improve the blood flow in your lower body and keep your muscles in a more relaxed and comfortable state. I had one patient who really stands out in my memory, an 81-year-old man named Arthur Lewis. Mr. Lewis had worked in farming his whole life, so his leg muscles were very strong. But starting around age 75, he began to suffer from leg cramps almost every single night. After talking with him for a while, I discovered that Mr. Lewis had slept on a hard floor his entire life. He also used a very thick, heavy quilt. But the biggest issue was his sleeping position. He slept on his stomach with his feet hanging off the end of the bed, so his toes were pointed downwards the entire night. This posture kept his calf muscles in a constant state of contraction for 6 to 8 hours straight. My first piece of advice for Mr. Lewis was to try changing his sleeping position. I suggested he sleep on his side with a pillow between his knees and another low cushion under his feet. He told me it wouldn't be easy to change a lifelong habit, but the pain from the cramps was so bad that he was willing to try, step by step. When he came back to see me 2 weeks later, the first thing Mr. Lewis said was, "Doctor, just changing how I sleep has already made a difference. The cramps have been cut by more than half." A month later, there was an even bigger improvement. With the addition of drinking more water and making some dietary changes, his leg cramps had almost completely disappeared. Now, he's able to sleep peacefully through the night and feels much more refreshed during the day. Light exercise is also very helpful. You can reduce your chances of getting a cramp by gently relaxing your muscles with about 5 minutes of calf stretches before you go to bed. It's enough to simply do an Achilles tendon stretch with your hands against a wall, or to sit down and gently pull your toes back towards your body. Let me tell you about one exercise that is particularly effective. Lie down on your back and put your legs up against a wall at a 90-degree angle, then just slowly flex and point your ankles. Doing this for about 3 minutes will greatly improve the circulation in your calf muscles. Massage is also a wonderful preventative tool. After you take a shower, apply some body oil or lotion and gently massage your calves from the bottom up. When you do this, don't use too much force. Just gently encourage the blood to flow back up towards your heart. Now, just take a moment to look at your own bedroom.
Are you sleeping under a quilt that's too heavy?
Are your feet in an uncomfortable position? Today, drawing on my 43 years as a doctor and my own personal journey, I've shared with you the story of leg cramps. That 3-second pressure point technique can free you from that terrible pain. I have personally experienced its benefits, and so many of my patients have confirmed it works. Let's quickly review what I've told you so far. First, it's important to rethink the real cause of leg cramps. It is not just about getting older. An electrolyte imbalance, poor blood circulation, and dehydration are the main culprits.
Please keep that in mind.
And if cramps are happening more than 3 times a week, I recommend you get a blood test to check your magnesium and potassium levels. Second, I told you about the 3-second pressure point method. Let's find that spot one more time. It's on the back of your calf where the muscles meet. Press firmly on that point with your thumb for 3 seconds while you breathe out, pushing just slightly upwards toward your heart. That's all there is to it. Do this not only when you have a cramp, but once or twice a day as a preventative measure, and you will see an effect.
Tiert is your daily management.
Drink 1.5 to 2 liters of water a day in small amounts, and continue to eat foods rich in potassium and magnesium, like bananas, spinach, nuts, and tofu. Your sleeping environment is also important. Instead of a heavy blanket, try putting a low pillow under your feet to raise your legs slightly. And please don't forget to stretch your calves for 5 minutes before bed. The wall stretch, or the exercise where you lie down with your legs up the wall, are especially effective. Some of you might be thinking, will these simple methods really make a difference? I felt the same way at first. But I encourage you to try it for yourself, and you will absolutely feel the change. Countless patients I've cared for have been freed from the pain of leg cramps using these very methods. People like Mr. Miller, who had cramps at the same time every night, people like Mrs. Carter, who was afraid to fall asleep, and people like Mr. Lewis, who found it hard to change lifelong habits, they have all experienced a positive change. The most important thing is to begin today. Don't feel like you have to do everything perfectly all at once. Tonight, just start by drinking 1 extra glass of water.
Tomorrow night, find that pressure point.
The day after that, try a few simple stretches, and then take a look at your sleeping environment. If you take it one step at a time, you will definitely feel like a different person in a month. When you can sleep soundly through the night, you can have a much more energetic day. Please don't give up and accept the various discomforts that can come with getting older. With just a little bit of care and effort, you can live a much more comfortable and healthy life in your later years. Just like me at 83 years old, I am practicing these health methods every single day, and I'm living an active, energetic life. It is never too late to start. Starting tonight, I encourage you to check that pressure point and take a look at your sleeping setup. And most importantly, drink a little more water. Finally, there is one more thing I would like to ask of you. Good health isn't created in a day or two, it's something we build through small, consistent daily habits. I hope that you won't give up on the methods I've shared with you today after just trying them once or twice, but that you'll continue to practice them. In my next video, I'll be talking about the common problem of waking up frequently during the night, and I'll share the 3 golden rules for getting a good night's sleep. Restful sleep is the very foundation of a healthy life. If you apply those tips along with the leg cramp solution you learned today, you can have a much more comfortable night. If you found today's video to be helpful, please subscribe to the channel and give it a like. Please help me share this useful health information with more of our fellow seniors. Your small show of support is a great source of strength for me and is the motivation I need to create more helpful content.
Thank you.